Some symptoms that scars might be interfering with your health or your fitness and ability to function. One of the symptoms is tightness. So just tightness in movement where you don't have the movement ability to move like you used to. A loss of flexibility. So going a little bit further than the tightness is that you don't have full range of motion and it's beyond tightness. When there's scarring, there might be a damage of the nerve, which can cause numbness where you can't feel where your body is in space. It could be pain, just a pain that is unrelenting and doesn't go away because your nerve has been damaged. You could have inflammation with the pain, and when you take care of the inflammation, the pain goes away. Over time, that could turn into pain or numbness because it's an indication that there's damage to the nerve. You could have weakness or loss of strength. You could have nearby organs, which I'll explain in a little bit, but you could have a decrease in the function of your organs. And you could also have internal pain. Where do these scars come from? And what are the types of scars? So you have just a scar from going about your life and you get a scar on your hand from cooking or gardening or work or whatever it is. You might have stretch marks from having a growth spurt while being hunched over, playing games, being on their computers. It creates those scars on the back like you see there. You might see stretch marks with fast weight gain. There's stretch marks with pregnancy. Any of those can cause a problem. On the next picture, there's a gentleman with a scar on his shoulder from shoulder surgery. So a lot of scarring is caused by surgery. And I don't have a picture of it here, but there's also the scarring with tattoos. And that doesn't mean you shouldn't get a tattoo. It just means treat little micro scars in there. And I'll share with you how to do that. So when you have your scar, it interferes with the nerve flow to and from your organs. The nerves go everywhere in your body. They go to your hands, they go to your organs, they go to your feet, anywhere where you have sensation, those are nerves. So you touch your face, that's nerves that's communicating. Nerves are telling your finger to do this, right? To tap your face, to anything that happens in your body is because of a healthy nervous system. Now, when we're looking at injury and scar, so this is a picture of somebody. The example is that she has perhaps a scar on her gluteal muscle from a fall. The nerves related to that area are on the picture on the right. And there's a big bundle of nerves in that particular area. And there are different parts of your body where there are big bundles of nerves that come together. But all the information goes to and from your brain, as you can see in this picture. So that's a picture of the brain and in the orange, and then the spinal cord. The nerves are safely encapsulated in the spinal cord, and then the nerves go out from the spine throughout your body. The picture on the right is the picture that I could find that had a most intricate nervous system. The one to the right doesn't even do it justice how complex the nervous system is. So you can imagine that you have the organs there, right, in the center. So we all know that it goes to your arms, legs, feet, goes to your skin. A lot of people forget that it goes to your organs. So if you can imagine that picture on the last frame is overlaid onto this woman's organs, those nerves go to all your organs. So when there's an interference that's on there, here's a picture where you can really see the nerves. When there's an interference with that nerve flow, things aren't going to work as well. And I think it's obvious that if you have scars on your fingers or your legs, that's going to affect you. So let's talk a little bit about how those scars on the outside even can affect your organs. Think about it like your organ is a lamp and the nerve is the cord going to the lamp. Where it's plugged in, that would be the energy center of your brain. And if that nerve gets frayed, or if the cord to the light gets frayed, the information isn't going to go to and from the nervous system as well. It's not going to go to and from the brain. The communication is going to be interrupted. So what can you do? You can put electrical tape on it to start getting that nervous system flowing again. And when that happens, all the information goes back up and down the spine, and the organs are lit up and happy. The nervous system is happy. Everything's working. All the communication is going through the body. The nervous system is incredibly complicated. So there's a lot that can happen with the scars and the organs in the body. So how do you treat your scars? You might be familiar with vitamin E. That is the most common way to treat scars. And vitamin E is wonderful, but let's consider what else might be helpful. Because why not go for the most? Wheat germ oil has vitamin E in it, but it also has vitamins A and D, which support the healing and nourishment of the skin and the nervous system and makes the scar repair even more effective. There is also chlorophyll. That is a natural solution if you have burns, cuts, nicks, inflammation, and it can help both internally and externally, and it nourishes and soothes your skin. It is also a natural antimicrobial and anti-inflammatory. Now, wheat germ oil is amazing, but be warned that it is also used for fertility. Chlorophyll complex has the chlorophyll as well as a little bit of some other things in it that help it work better, help the chlorophyll work better. I love this because it helps with internal healing. If somebody's had miscarriages and they want to heal their uterus, then chlorophyll complex is amazing for taking internally. That is also great for any internal scars. So the chlorophyll complex, if you have any scarring in your mouth, the chlorophyll complex is great for that. You can chew it and it'll turn your teeth green, but it's definitely helpful. The ointment on the right can be used for hemorrhoids or topically. It's black and goopy, so just keep that in mind when you're using that. And how would you know what is the best supplement for you to use for healing your scars? Of course, I love muscle response testing, especially quantum response testing. You can look for a link below for a book that explains how to most safely and effectively use muscle response testing to help you. There is a video up here for quantum response testing, so you can take a look at that. And then over on the other side is a video on how to do self-testing.